Okay, can you hear me, by the way? I asked them to change it to orange because it's my favorite color. But anyway, Dr. Sohail, thank you so much, and I'm a big fan of Dr. Sohail. I've been following him for all my life in digital health, so thank you for being a shining light. But let me start with the last slide. Can I move it to the last slide? I want to reverse my slide deck because you've seen the first. How many of you have seen the session downstairs? How many of you have been downstairs checking the session? So all of you are new. Excellent. How many of you have implemented EMR? I want to start with thank you for being here after lunch. So I really appreciate it. Put your hand up if you know or you've implemented electronic medical records or hospital information hospital information systems. So I was thinking of an acronym for HIS, Hell in Systems. Why? Because implementing HISs and EMRs is always hell. In the sense that it's not the technology, guys. It's everything but the technology. Okay? How many of you are clinical in healthcare? Put your hand up if you're in healthcare. Okay, how many of you are selling technology or technologists? Okay. How many of you are just enjoying the day and passing by? Because I see some hands not being raised. Okay, maybe a few. Okay, excellent. So, what's the difference between HIS and EMR? If I may ask the audience at the back, what's the difference between HIS and EMR? Go ahead.
EMR is about the related to the patient's data, and HIMSS is related to all the hospital.
Absolutely, HIS, absolutely. So mostly the HIS is a big umbrella. That's what we're not philosophically debating, but it's a bigger umbrella. It includes other stuff, right? And that's why I wanted to start with the last slide. Because if I tell you a hospital information system consists of the following slide. How many of you like Legos? Have you played Lego? Yeah, at least more hands. Okay, so let me go back. Nope, no. Yeah, this is a hospital image or all the systems that will run in hospitals. Okay, so you do have the electronic medical record that has whatever is attached to the patient record, but you have other systems as well. I mean, this is just my attempt with my colleagues back in my previous job to try and think of what are all the hospital systems that exist. Some of it are clinical, some of it are administrative, some of it are non-clinical, some of it, as my brother Dr. Shahram said, infrastructure related. There is revenue cycle management, so health finance, there's ERP and whatnot. So an EMR or a HIMS, okay, it's a piece in the jigsaw, in the puzzle. But it needs to be connected in that puzzle. So my story, I started, by the way, I'm an engineer. I'm not even a healthcare guy. Okay, graduated and by mistake I came into healthcare. My PhD was in specifically quantum electronics and its uses for nanotechnology in cancer detection. That brought me into healthcare by mistake. My first job outside academia was in a company called Cerner. How many people know Cerner? Okay, very good. One of the biggest electronic medical record hospital information system companies in the world. Now it's not called Cerner anymore. What happens? Exactly, it was acquired by Oracle. So when I was looking at a hospital information system, I wanted to ask a clinician, does this mean anything to you? Do you need to care about this? A doctor like Dr. Sohail, who deals with patients continuously, does he need to know what other systems are there? Or does he need to know that the result is coming to his screen whenever he pushes a button? He cares about the outcome, right? So the biggest issue when you're implementing electronic medical record is, number one, fitting it within this huge Lego land, this huge jigsaw pieces. Because you need to make sure, if you are the vendor, you're happy. You're making most of your money when you are selling the license. And then you can milk the client later on with professional services and support and maintenance. Is that right? Yafuz we're gonna tell us more about that. The best thing if you are an HIS or EMR system platform provider is the license, because this is mostly upfront. Okay? That's where your profit is. But if I'm a hospital administrator or a clinician, what I care about is this: whatever I click is going to save my patient. I'm going to get the information in front of my eyes. That's why I called this slide, by the way, the rise and the fall of EMRs and hospital information system, because now the AI is actually challenging all that. Do you need to actually implement a hospital information system as one piece, put all your eggs in one vendor called Cerner, and then it gets acquired by Oracle, and then they have to actually contract you separately, they have to actually make your life hell as a hospital administrator or as a clinician? Or shall I just look at a huge piece of different pieces, and then I have to employ people to make sure that they are also looking at how to pull this all together? Because an EMR is just one piece of the complicated jigsaw. Are you with me or not? Because some of you might not know what an EMR or an HI is, but if you go to any hospital environment or clinic environment, I want you to think of this. Think of Lego. Think of the puzzle map, the jigsaw. Okay? Let me go back. Now, there is a lot of trends. Everybody talks about the patient experience. Oops, Mazin, it's not called patient, it's called the beneficiary experience. Now, how do we digitize the movement of the user of a hospital? Everybody here has visited a hospital or a clinic, correct or not? Put your hand up if you have never visited a hospital or a clinic. Nobody, yeah? Excellent. Maybe the cameraman. Okay, good. That means you've actually gone to a hospital and clinic. That's why you have been into any of these or any organization for asking for care. Definitely you have been asked to fill in forms. You've been asked to upload your information. You've been asked to give some tests out. That's why the healthcare is patient-centered, because they want to follow you from entry to exit. Not only that, the new EMRs and HISs and the digital health is looking at extending applications to your home. So we can actually use your mobile to fill in the information. We can track you while you're at home, especially if you are doing post-procedural rehabilitation, let's say. There is always going to be talk about how do you manage your spending. Do you buy all your information system for a hospital from one vendor? How do you actually manage this? Some hospitals don't want to buy electronic medical records. They want to grow electronic medical records, right? And you see these examples now across. Sindhu Health System is one of them. They grew their own health information systems, which means that later on you become self-independent or self-dependent. You can have plans to commercialize these systems or utilize them to actually go out and offer it to the community. So you're in control of IP. The first question you now witness whenever you go to a hospital, if you have a mature hospital, they'll ask you whether I can keep the IP or not, sometimes. Because they want actually to have the source code. The electronic medical record or hospital information system, they want jurisdiction over that, so they can do the modification. Okay, there is also another concept of public-private partnerships. So whenever you're thinking about public-private partnerships, you can actually, as a hospital, become a partner to an EMR vendor. Maybe I cannot pay upfront, but let's develop and customize your EMR with us, and then we can actually revenue generate together. So now how do you contract with your EMR vendor or your HIS vendor is also being disrupted. Not just the use of technology, but the relationship between hospitals and hospital information systems. This is why these are some new trends, and it goes back to Dr. Shahram's point. The maturity of the hospital defines the way you will contract your vendors, including your EMR and HIS. That's why the headache with HISs and EMRs is not the technology. It's the contracting, it's the adoption, it's the training, it's the sustainability. The technology, Dr. Shahram has done a great job showing you the different components. In my 6 years in Cerner, we've implemented electronic medical records across the UK, France, we went to India, we went to Australia, in Saudi, in Egypt. You know what is the number one issue that I've seen? My personal opinion? Not the technology. What do you think number one issue is? Sorry? People. My biggest issue when we implemented this in Abu Dhabi is language. People don't know what ICD-10 is. Do you know what ICD-10? What does it mean? Amazing, you're a superstar. Pharmacist or medical doctor? Medical coder, even better. By the way, medical coding is number one job now in the hot market. You want to get a job quickly? Become a medical coder. Because the biggest problem is translating doctor jargon into money is them. Not having enough skilled people to do that, especially in the for-profit sector. So that's another headache in your electronic medical record. The ability to translate a doctor note, a nursing form into a coded claim. It sometimes happens within the same EMR, and I'm always pointing to Yavuz because Yavuz is always winning in implementing his HIS across. In the Gulf region, they always went for the Rolls Royce of HIS. But as the maturity grew up, they started thinking it's not always about the best and the biggest and the most expensive HIS. It's not. It's about what makes you and your clinicians more satisfied. Because number one issue when you implement is the people. Your clinical workforce is not included in the decision making of your EMR or HIS. It's like a Lego piece. When you start designing your EMR and HIS, you need people that can join you as you validate and test. How am I doing for time, doctor? You have to keep me 5 minutes? Very good. This is how complicated the landscape of healthcare is. Now we have also pharma coming in and using HIS and EMR capabilities when they run their patient support programs. Because now we have new players that are actually using digital patient records to try and collect data. It's not about selling the technology, it's about getting the data. The money is in the data. The juice is in the data. If you are non-for-profit, it's okay. The research is in the data. Whatever tool you use, you collect the data correctly with efficient clinicians, the better your organization can do research. That's why the maturity of our providers for healthcare are becoming bigger and bigger. That's why vendors don't control the hospitals now and in the future. Hospitals will control the vendors. And that's why I predict the market of HIS and EMR with maturer hospitals and clinics will decline. No longer you're going to give all your apples and oranges into one basket. You might grow your own business. You might work with a partner to co-sell together. Maybe Yavuz might be concerned now. You're not going out of market or out of job, but you're going to disrupt the way you work with hospitals. So far, so good? So, now you see a lot of organizations in the Gulf region. We look at sovereign wealth funds. They are creating companies that can actually take the concepts of electronic medical record and hospital information systems and add components like AI, patient portals, physician portals to actually create comprehensive packages and resell it to other countries or other hospitals. So new concepts are coming in. New players in the market are coming in. And the last slide, I want to show you a comparison. In the UAE, we used to have big players in HIS. No longer is the case because we are seeing new players coming into the market. But the EMR market has disrupted the way we focus on how we build our governance, our policies. Implementing an electronic medical record will question every clinical guideline and policy that you have. It's a whole change of mindset and culture. That's why it's a whole economy. If you look at the big players and their dominance of these three countries, this is what new players are coming in to play with. Because they are losing the grip of the market. They are introducing new maturity from a regulation perspective. They are also looking at the innovation that is being built on the legacy systems, the old systems. And my last slide, that's why we are always looking at the health systems. If you have a mature, centralized health system, it's always good to understand how the health system operates and how hospitals should be digitized from the EMR onwards. It's not just a one single implementation that you need to think of, because you need to cater for the complexity of the system. You need to cater for the clarity of ownership and decision making. You need to always involve the clinical community. You need to think of how your workforce will be enabled. Our biggest issue is people not even understanding simple standards, ICD, CPT, as we implemented EMRs. How do you enable those people, clinicians and non-clinicians? And how do you align it with important concepts like public health? When we had COVID-19, the worst performing systems in our areas were the vaccine management systems that were implemented, because they were not connecting with EMRs or HISs properly. So the whole picture, trying to give you some use cases and some stories on what is an EMR and how HISs and HIMSs would actually change the way we look at healthcare. I hope this was helpful, doctor. I don't want to stay any longer. But remember, this is the most important aspect. This is the last slide I want to remind you of. Where is my HIS in this whole jungle of applications? And how can I bring the doctors, the nurses, the coders, the pharmacists, because these are the real users, to sustain their growth, to sustain their service, to sustain their quality, with partnerships with EMRs and HISs. How can we co-create together? Not just put all the eggs in one basket and start blaming the partner, the vendor. You did this, you increased the price. So far, so good? So think out of the technology. It's always not the technology. With this, I just want to thank you. I hope this was useful and hope to hear from you later on.